Hello, I'm Dr. Ujwal Ramtekkar for the Joint Child Psychiatry Toolkit of the American Psychiatric Association and the American Academy of Child and Adolescent Psychiatry. I'll be discussing the utilization of a model of care provided by Project ECHO in the practice of telepsychiatry with children and adolescents. Project ECHO, or Extension for Community Healthcare Outcomes, was established in 2003 by Dr. Sanjeev Arora, a hepatologist at University of New Mexico, who was frustrated by socioeconomic disparities and access to care barriers that prevented thousands of New Mexicans with hepatitis C from receiving appropriate medical care. There were no specialists embedded within or near these individuals' communities, and they did not have the resources to travel to distant specialists. Project ECHO model is considered a hub and spokes and learning collaborative model. It was designed to reduce access to care barriers for populations in underserved communities by using telehealth technologies to link a centrally located multidisciplinary team of specialists at a hub with primary care physicians in the spoke communities. The specialists do not provide direct patient care to the patients in these underserved spoke communities, but serve as a resource for the primary care providers, guiding them through didactic training and real-world case consultations across telehealth platform. Since its establishment, Project ECHO has expanded to more than 35 states and 25 countries globally. The Project ECHO model is especially relevant in increasing access and building capacity in child and adolescent psychiatry. There are insufficient child and adolescent psychiatrists to provide service for the growing population of children and adolescents who are in need of mental health care. Even if the efforts are successful to recruit a lot of medical students to enter into the field, it will take many years to mitigate the critical shortage of child and adolescent psychiatrists. Moreover, most of the practices are concentrated in urban areas that are not readily accessible to many families in rural and other underserved areas. As a result, primary care physicians in those communities are increasingly expected to fill this gap between supply and demand. Implementation of Project ECHO model is simple, affordable, and offers systematic and multiplier benefits for primary care providers, patients, their families, and communities as a whole. Current telepsychiatry technology has relatively low setup costs and can be implemented without utilizing substantial resources. A Project ECHO team may consist of a multidisciplinary team of child and adolescent psychiatrist, a psychologist, social worker, and a pharmacist at the hub site, and primary care physicians and their office staff at the spoke sites. A typical 1 or 2 hour session includes a short targeted didactic, followed by a case consultation presentation, which is usually done by one of the primary care physician, and discussion that is facilitated by hub team experts. A network of other professionals may be invited to join the collaboration at either site. These examples include teachers, juvenile detention officers, parent advocates, just to foster a collaborative and supportive learning environment. Project ECHO facilitates growth in primary care physicians' abilities to confidently screen and provide care for children with mild to moderate behavioral health disorders with support from child and adolescent psychiatrists on the team. This opens up the capacity of psychiatrists who may now focus on youth with most acute, severe, and unstable psychiatric disorders. The benefits to families include increased access to expert care, decreased need to travel to distant sites to see specialists in person, timeliness of care, and decreased financial burden due to less work absence and co-pays for specialty care. In addition, the care is maintained with a trusted primary care provider, possibly avoiding the stigma associated with seeking psychiatric care. In summary, the current model of child and adolescent psychiatric practice is not sustainable to meet the nation's growing population of youth in need of this specialized care. Project ECHO model uses telepsychiatry to extend the reach of child and adolescent psychiatrists, increase youth's access to need psychiatric care, and build capacity through a virtual collaboration of psychiatrists with primary care physicians. For these communities, then, health outcomes are improved and disparities are reduced. I'm Ujjwal Ramtekkar for the Telepsychiatry Toolkit. Thank you for watching.